health. I think one of the most interesting thing about vaping is the colors, which is why you see my screen is very colorful. So I did a master's in public health, and my topic was vaping as well. And now I'm a PhD candidate, and my topic is still vaping. So as we go through the slide, I will explain to you what vaping is, the devices they have on the market, and how it affects your oral health. So what is vaping? So vaping is basically an act of inhaling and exhaling an aerosol that comes from a device. They normally call these devices vapes or electronic cigarettes. The kids have different names for it. And the device is basically what it does is that it heats a liquid. It heats a liquid that contains different chemicals. Some of them have glycine, some of them have nicotine. You can buy some without nicotine. And there are hundreds of thousands of flavors out there with different additives as well. And as you inhale it, you're inhaling an aerosol that contains different chemicals. So the devices we have on the market, we have disposables. These are the ones that you use and you throw away. So they're the most easiest ones to use. Normally beginners pick these up because you don't need to assemble it. You don't need to set it up. So if you look on the market, we have different ones. Some come with different number of puffs, from 200 puffs to 5,000 puffs, depending on the person that you are, which is just an average that they give. It's an estimate of how many puffs you can get out of it. And as soon as it's done, you throw it away. Then you get the pod systems. Now, the pod systems are the ones that you refill with liquid. So you get these cartridges that you fill from the top, and as soon as that liquid is finished, you refill it again. These are normally rechargeable. They come with a charger, and you can decide which flavors you want to buy and change as it comes along. And then you get the bigger devices. We call these the vape mods. Mods meaning modifiable. You can decide what type of battery you want. You can decide the type of coil you want. You can decide the type of tip you want. So it's basically you pick and choose what you want. So this is one of the biggest devices on the market because it can go up to 200 watts, the battery. It comes with a screen if you want that you can change the temperature. You can change the amount of volts it's giving. You can do whatever you want. One of the most expensive ones as well, because you get to decide what you want. Okay. So as you can see, these devices can come in any color, any size, any shape that you want. They're very colorful. And on top of that, you get different types. They look cool. They look stylish. I mean, the first time I saw vape, I was the most interested person on the face of this earth. And I think it was because they were just colorful and they looked cool. It's like I always explain it. It's as if a new iPhone is coming out every 2 months. That's how I describe it, because you can get whatever you imagine the vape has it. I mean, you get devices with big screens like this that look like a small little gadget. Then you get ones with games. I mean, these are one of the latest ones that are overseas at the moment. And this one that it looks like a smartwatch. You can connect it to your phone. You can check the weather, the time, and this is what they're producing out there. But as much as these things are stylish, we need to remember that it does pose a risk to our health, to our oral health. One of the arguments that is out there is that they always say that, but isn't it better than smoking? And yes, research has shown that it's not as dangerous as smoking. But what we need to remember is that it still poses as a risk. Okay, the nicotine in it affects your oral health. You can end up with a dry mouth. A dry mouth basically means that you're not producing enough saliva, which can lead to xerostomia, which is what a dryness of the mouth is, which can lead to a black hairy tongue. Okay, so when you have a dry mouth, you're prone to caries. You are prone to a lot of bacteria entering into your mouth because it's a dry mouth and it's conducive for bacteria to grow in it. Then you get oral cancers. Okay, there's no research at the moment that says e-cigarettes or vaping causes cancer. But what they discovered is that nicotine does play a role in the progression of the oral cancer, and that there's a lack of studies out there. And as much as we like to say that no, but it's not, it's less toxic than combustible or traditional cigarettes, there is still a toxic level to it. Okay, so there's still a risk, although research hasn't been able to show the definite connection, it still poses as a risk, and they've been able to prove it. You get gum diseases. The fact that what's in vape actually causes inflammation. It can lead to gum diseases such as gingivitis. You can see your gum starting to turn a bit reddish, some start bleeding, and some actually advance into periodontitis where your teeth start moving, they start shaking, or your gum recedes. That's what we are seeing. There was actually a case in the States where they basically, an oral health professional had 3 of their patients come in, and he couldn't explain why they were getting tooth decay. And one of the things was that he picked up is that all 3 of them were vaping. And vapes, as we know, they're acidic. The vapors are acidic. They have a sugar content as well, which can cause plaque to build up, which leads to tooth decay. And remember, you're already experiencing a dry mouth, which, like, bacteria screams in a dry mouth. It lives in a dry mouth, which increases your risk of caries. Then, of course, we have the worst part, which is your explosions, okay? So cases around the world, over 2,000 of cases have been documented where e-cigarettes have exploded in people's mouths. People have basically lost a part of their jaws. They have lost teeth. They basically, yeah, a lot has happened. Some have been burnt by it, okay? And this is just not only the mouth, but a lot of the time, some have got burns in their pockets, on their thighs, when they put it in their pockets, and in other body areas. So this does happen. And as we say, these are only the documented ones. We are not sure of the ones that are undocumented, because and when you read up on the cases, what you read is that majority of them, it just happens spontaneously. They have it in their mouth and it just blows up, which poses as a risk. And these are the risks that you experience, you're prone to if you start vaping, and if you do. So to conclude, what do we know? What we do know is that it's being presented as being less harmful than smoking, which is true, because this is a new device on the market. Okay, we still do not know fully exactly what it does. And I think in the next couple of years, the next decade, we will fully understand what vaping does. Secondly, it's associated with a negative oral health outcome, the gingivitis, the bleeding gums, the dry mouth. And as I said, the moment you have a dry mouth, you are prone to a lot of caries. You are prone to a lot of rotten teeth. And that is what we see in the patients we examine. And the reality is that more research needs to be done. More long-term research needs to be done, which we will only know in the next 5 to 10 years exactly what it does. But what I want to stress is that this has a risk. This has a risk to your health, not just your oral health, but your health in general. There has been studies that have been done that have linked vaping to asthma. There have been studies that have been done that have linked vaping to cardiovascular diseases, to lung diseases. There have been cases, as everyone knows, of the popcorn lung, where patients have come in and are struggling to breathe, and they discovered that they were vaping. And these are the lung-associated diseases that vaping causes. So oral is just one part of the body that it affects. It also affects your whole body. So why I am here, why Sada decided to invite me, is that we want to inform patients. We want to inform patients of the risks of vaping, the risks of taking on these devices. As much as you are drawn in to it, there is still a risk. Because a lot of the time, I actually ask my patients. I ask my patients when they tell me they're vaping, and I ask them, what do they think about vaping? And they say, no, it's a lot better than smoking, and those sweet and those sweet, sweet flavors. And it's great. I mean, I had one person that told me that vaping, they take on vaping to lose weight because they decided that if they crave a chocolate, they're going to go find a vape that's a chocolate flavor and they're going to smoke it, and it works. So the vaping industry has sold it as something that's less harmful, as something that's fantastic to do. It smells nice, but it poses as a risk. And we need to be aware of that as the public, that this poses as a risk. Yes, it might look harmless. It might smell harmless, but it still poses as a risk. And as we go through Stoptober, where we're trying to get people to start smoking, this is one thing we need to take on as serious, that vaping is a serious thing and it poses a risk to your health. And that is it. So thank you so much for listening to me. It's been a pleasure. I want to thank Sada for having me on. It's always a pleasure to come and speak about something that I am very interested in and something I'm very passionate about. So thank you all for listening to me. Goodbye.
Thank you, Dr. Kudenga.